This tutorial will explain what the colors and columns mean and what they are used for on the tracking board. By the end of this tutorial, you will be able to explain what each color means and verbalize the use of each column. Bed. This is the room number column. The room number will flash green when the reg alert has been turned on. N is the name alert column. When an asterisk appears, the column will be yellow to bring attention to similar names in the ER. Patient. This has the patient's name. The area will be blue on the desktop and black on the big board if the patient requests opt-out. The space will be pink with the word dirty when a room needs to be cleaned. When it is clean with no patient, it will be gray in color. When a room is blocked, the namespace will also be black. T. The number of the triage level appears here and is imported from the chart. Complaint. This is the chief complaint that brought the patient to the ER. If the patient has not been triaged and the LOS, length of stay, is greater than 30 minutes, this space will be yellow. Reg. This is populated from the Modify screen and gives information about registration status. For those who are quick admitted, this should not happen. A yellow QA will appear. Quick registration will result in a cyan QR, and a fully registered patient will display Reg in green. Lab. A green Y will appear if all the labs are normal. A red Y will appear if they are abnormal. If there is a critical level, an exclamation point will show. If the user logged on has not looked at the labs, they will flash until this is done. Count. The first number is the number of labs that have been resulted. The second number is the number of labs that have been ordered. DR. Once the doctor has assigned themselves, this is where the doctor's name will appear. If the patient does not have a doctor assigned, then the space will be blue. If the MD alert is on, the space will be cyan. RN. The nurse's name assigned to the room will appear here, and it will turn yellow if the RN alert is on. LOS. This gives the length of stay. It will turn yellow once the patient has been in the ER more than an hour but less than 6 hours. When a patient has been in the ER more than 6 hours, it will turn red. RN to do. This column alerts the nurse that there are orders that need to be completed. The nurse may click directly on the words to do to go to the part of the chart to complete the order. Tech to do. This column works in the same fashion as the RN to do. It only alerts the tech there are orders. An RN may complete the tech to do as well as a tech. Bed R. Bed request. States a bed for admission has been requested. Room number. Lets you know what room the patient is going to. Miscellaneous. This column has 11 choices in the Modify screen, which includes items like iStats. Dispo. This alerts the staff that a decision for disposition has been made. If the patient is being discharged, the word discharged will show in green. A yellow admit will show for admissions, and a cyan transferred will be displayed for those patients being transferred out of the hospital. Comments. This is a free text area which can be reached from the Modify screen. The columns appear different on the big board or in the waiting rooms, but the colors will remain the same. The colors are used to draw your attention to an item.